to Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, COVID-19 is still on. We're now talking about second and third waves within the first wave, and all over the world we're seeing all kinds of things happening. And now people are talking not just about the one pandemic called COVID-19, but we're talking about secondary pandemics, tertiary pandemics. In fact, they're talking about 4 pandemics at this point in time. The original pandemic, which is COVID-19, a pandemic of drug abuse, a pandemic of domestic sexual abuse, and of course the economic what do you call it now, downturn all over the world. So people are hurting, and for sure, as you know, if you haven't realized this by now, it's affecting our mental health everywhere. And with the mental health burden already in its heights in this 21st century, is even going to get higher during this pandemic period. So it's so critical for people around Nigeria and around the world to understand how this not just affects your mental health, but affects your physical body as well. And so in a short time, I'm going to introduce my 2 guests on the show. But before then, I want to talk about how a little bit of medicine and physiology, and just basically show you how this whole thing works, so you get a clearer picture of what's going on inside you, so that you can be able to protect yourself and your family and safeguard your future, so that this doesn't become a long-term problem in your life. So let's go to the board. Okay, so let's just, like I said, this is going to be as basic as we possibly can, but I think it's important for you to understand this. So basically, I call it the central governing system. The brain influences the hormones, and we have a lot of them, including the sex hormones like testosterone and estrogen, which, of course, determine your sexual characteristics, libido, your menstrual cycles, sex drive, etc. And of course, the immune system, and we've talked a lot about the immune system. So here's how it works. The brain affects the hormones, and the hormones affect the immune system. And of course, the immune system, and about a quarter of all the cells in your body are immune cells, and they affect all the, 100 trillion cells. There are different numbers. Some say 37 trillion, some say 100 trillion. They affect everything else. But here's the thing. These systems and your cells all affect the immune system, and they go back and they affect the hormones, and they go back and affect the brain. So it's not just a one-way street. Like, for instance, we know that the brain affects the gut, and the gut, the digestive system, affects the brain. I'm saying all this to say this. Overriding all this, the central governing system is I would call it your mind and your perceptions and the way you see things. Yes, it's part of the brain, but it affects the brain. So something like stress, so whether it's financial stress, emotional stress, stress between your spouses, stress between the worker and the supervisor, any kind of stress is going to have a damaging or negative effect on the brain, which will have a negative effect on the hormones, a negative effect on the immune system and the rest of your cells. So you can think about it, and you all know this. If you're depressed, I love this quote. It says that depression, first of all, maims the mind, and then it kills the body. Depression maims the mind, and it kills the body. It maims or paralyzes the mind, and then it kills the body. And so you can see that if stress affects the brain, if there's depression, so depression is a kind of stress. If it affects the brain, it's going to shut things down, and if it shut things down here, so this hormones don't work as well, and it's going to shut things down here, so your immune system does not work as well. That's why you have greater incidences of colds and malaria when you're under stress or when you're depressed. That makes sense to you, right? And it happens in so many different cases. I was also going to say, I hope I can remember what I was going to talk about now, but yes, I remember. So stress, and stress could include boredom, we've said it includes depression as well. When stress affects the brain, it affects certain parts of the brain. It affects your memory centers, it affects your sleep centers, and it affects the part of the brain that has to do with judgment and control. And it basically inhibits them. So things that you otherwise would be doing, you're not doing, and things you shouldn't be doing, you're doing them. And of course, we're going to have a psychiatrist to really explain all that. That's why you see a lot of anger, uncontrolled even where sex is concerned, where the men are concerned, many of these things can be traced back to a dysregulation, a lack of control of the judgment or executive centers of the brain, which would otherwise say, don't do this, don't go that far. And most of us have it. All of us have it, really, we should have it. But stress has a way of depressing that and keeping you from doing the right things. So it's all important. Again, I'm just saying all this so you can understand what we're dealing with here. When you're dealing with a pandemic or a fourfold pandemic as what we're seeing today, you can easily understand why the burden is so high and why we're seeing all these cases, all these terrible cases, this atrocity is being happening around the world. There is no excusing it, obviously, but it's also important that we know and understand so that we can protect ourselves from these things. So we're going to take a short break and then we'll bring in our guests. See you soon. Welcome back. All right, so with me in the studio is, well, we have two, so we're really lucky today. First is Dr. Ada, who is a consultant psychiatrist in private practice. Thank you for being on.
Hi, Dr. David. I'm so happy to be here with you. Thank you for having me.
Thank you for making it. I'm really looking forward to it. We've had some really good conversations before we went on air. So
we get along, don't we?
We kind of like hit it really well, didn't we?
I think so,
yeah. Looking forward to it. And of course, Zion, who has been on a couple of times. Zion is a mental health advocate and the founder and CEO of Mandate Health International. I'm missing something somewhere.
Yeah, the Mandate Health Empowerment Initiative.
Mandate Health Empowerment Initiative. And I think this is a really good time. By the way, seriously, speaking of the economic downturn, or however we want to put it, and then the mental health consequences that are risen out of that, and of course, Doc, you're dealing with depression, abuse, drug addiction.
That's right.
Man, is there any end in sight?
Yeah, it's kind of like tough right now.
Because we growing up in Nigeria, I think we used to think about depression and suicide as a thing that happens to white people, right? That we black people are more, we're more sturdy than that, but that isn't the case at all.
No, that isn't the case. About 40 million Nigerians are living with depression.
40 million.
40 million.
This was pre-COVID.
This was pre-COVID.
Oh, wow.
Pre this beautiful picture of the stress response that you pre all that.
Wow.
So the estimate is that it's gonna be a lot more, but before this virus is done.
What's driving it? I say it's just because people are staying at home more. Is it the fact that economically, what exactly? It's hard for one to put head around the fact that people are now turning on minors and raping minors as a result of what? Staying at home more? Can you make sense of this?
Yeah, you mentioned, we're dealing with more than one pandemic.
Yeah.
It isn't just the COVID pandemic, like you said. We're dealing with economic crisis. So a lot of families are not sure how to put food on the table. Those who are underemployed, those who are unemployed, there's going to be a lot more people being pushed down into poverty. And as we've seen for suicide, in many cases in Nigeria, it's secondary to frustration. So there's this frustration. What's my future going to look like? How am I going to work and put food on the table? And so what happens with that frustration and how people metabolize that frustration and whether they have healthy adaptive ways of releasing that tension. If not, then they'll start hitting. They'll start raping, they'll start, abusing, and for men, more than other men and children, tend to manifest their depression as irritability.
Men and children?
Men and children, more than women.
Interesting.
So for women, you'd have this classical sadness, crying spells, loss of interest. But for men, and children, there's an added component of irritability. So the man will start lashing out. And that's because he's sad, because he feels he's losing control of his environment.
And men like to have some semblance of control, maybe more than women do. Is that
absolutely? Men are the head, they're the leaders.
The breadwinners.
They're the breadwinners in most cases.
In most cases.
80% of women working in Nigeria work in the informal sector. And that is one of the sectors that's been hardest hit
Right, because Nigerians are used to earning their daily bread
That's right,
literally. So
that's right.
each day they go out, they get some money, come back. Each day they go out, get some money, come back. But that's because of the lockdown has shut that.
Has shut down. I mean, there is lockdown, and who's buying? Everybody's indoors.
Yeah.
People are hardly going out, and when they're going out, it's only for essential. So that leisure, the whole, leisure industry.
Yeah.
Where people would sit out and eat out, and all these things that where people could get money for their daily upkeep is no longer there. So
and then somebody was also mentioning too, one of the top brass at NTA here was like, usually people, even the lower level workers at the lower level grade levels, he said that once they telling people to go home to sit down, it's not really a punishment many times. It's like it's more of a punishment than people think it is. When they ask them to go home maybe for whatever, because he said when they come to work, obviously there's a social part of it where they mix with their colleagues and all that.
Yes.
But then also, especially in Nigeria, you get a chance of see Oga, how was your weekend? What's this? And then they drop something for
That's
you
right.
and all that. So money comes in through informal ways other than their salaries.
That's
so they don't
right.
get to touch their salaries as much. But now they're at home, they're forced to be at home, especially when the decree came out that anybody grade 12 and below should stay at home. They're now at home, especially the men. They're listening, the kids are running all around them. Daddy, I want biscuit, Daddy, I want chewing gum. And all of a sudden, he's now being bombarded by things that he's not been used to being bombarded by. His wife is asking for this, or she's trying to remind him of all the other things that should have been taken care of many, many years ago that have not been taken care of. And all of a sudden, he's constantly being bombarded by things he wasn't being bombarded by before.
That's right.
And so, in a way, that also adds to the stress.
Yes, I mean, there's extreme stress, there's frustration, there's uncertainty. Change is something that's supposed to take time. We're supposed to be able to prepare for it.
Right.
We're supposed to be able to go through the changes gradually. But all at once, over a period of weeks, this pandemic was upon us. And then there was a lockdown, And so there was no time to prepare. And so the body went into what you described in your discussion on the blackboard, which is into a heightened state of alert, as if a bear was in the room or a lion was in the room.
Because we're used to it.
We're not used to it. There was no adjustment period. It was just there.
Right.
And so the body went into a period of hyperadrenergic overdrive. Where large quantities of vasoconstrictive substances were being secreted into the bloodstream.
And by vasoconstrictor, it means that the blood vessels are tightening up.
The blood vessels all over the body are tightening up.
And that's not good.
That's not good because perfusion, the way your heart muscle, you need to have a relaxed, open, perfusion to your heart.
Right.
Your heart perfuses the rest of your body. That's how your cells feed. All of that has been disrupted. And so people are in a state of crisis. And then, like you mentioned, people that were already vulnerable, who are already on the edge, whether economically,
right,
whether financially, or whether even in terms of the domestic violence situation, or who had pre-existing conditions, who had emotional health problems, where they were holding on. Now this has tipped them, into the full-blown,
so you're saying it was just under the surface all this while?
Yes, for many.
For many. And this just kind of like give them the release. Because I think so too, think about it in the evenings when frustrations, guys would just go out and to the garden and just drink there and sing and watch the ladies dancing and all that.
Right.
And then they'll be able to say, I can face another day. And then of course for those who are more religiously inclined, they go to church and they get all that. But even that has been taken away.
Yeah, no more church.
No more church.
That's very sad, to really think of it, because right now, quite a lot of persons have lost their community. Community here, I mean, like you just mentioned, for some people, the community that they've lost is the religious centers.
Yeah.
For some people, the community they've lost is the social gathering that they're used to, that have actually been a kind of a way that they have developed as a mechanism to cope with their daily stress.
Right.
You know, but for now, you find that a lot have changed, and we're beginning to live in a new normal. And this new normal,
I don't know if you can call it normal though.
yeah, I mean, it's something that we really can change. So it has just come to stay with us. So people just need to realize that they have to right now begin to develop new coping mechanisms. You know, like you were saying earlier, one of the things that we notice right now is that the resilience people have tried to like build before now that have enabled them to cope or to manage the stressors, the concerns that have affected them either in the family or the workplace or in their career, in their businesses, have really faded off. Yeah. And because this has affected the resilience of people and also has also affected their coping mechanisms, it's really going to tell on us and to really look out to see that the mental health of people, the global burden of mental illness will be on the increase.
Right. So, and we don't want to paint a totally bleak picture. Obviously, it's a bleak picture. But at the same time, we also want to now talk about what can be done, whether at the individual level or at the state level or the government level.
Okay.
And hopefully somebody will listen to it. So at that point, we'll take a break here and then we'll be right back. All right, welcome back. There's a lot to be talked about when mental health is concerned. So we definitely are going to have Dr. Adan Zion back. Mr. Ame. I call we definitely need to get you guys back.
Thank you.
I call him Zion because we were in the same school. You didn't even meet me in school, man.
No, I didn't get to catch up with the brake light.
You had a brake light. This is news. Wow, I have to hear more about that.
It's news to me too. I gotta tell you, it's news to me. So we're going to talk about the different levels of what can be done where mental health is concerned. Obviously, we want to talk about the policy at the national level. Then, of course, with the healthcare level, whether it's private or government, what can the doctors, healthcare providers, nurses, and all those who deal with patients, especially in this period, what can they do? I mean, I think we need to operate with the intent or with the background that everybody here is stressed. Every patient coming your way is stressed. So you have to factor that into whatever treatment is concerned. We'll talk about that later. And of course, in my opinion, the most important aspect, which is at the individual level. What can the individual do to safeguard himself or herself, build resiliency, and ensure that their family they are protected? Because this is all over us, all around us. So, but I think we should start at the national level, which is what Mr. Ame is really passionate about, which is about the whole policy, and in this case, dealing with COVID-19 and mental health.
Exactly.
Yeah.
You see, it's just very glaring that the issue of COVID-19 pandemic has opened up, how the government has really not prioritized mental health. It has just opened up the vulnerability of mental health in the health sector. We're just seeing that, look, there's really a huge gap that's been existing in the health sector. And there's never a better time, I can say this over and over anywhere, there's never a better time that the government should consider prioritizing the issue of mental health in this country like this moment, where we have, cases of suicide on the increase, we have cases of people coming down with psychological disorders on the increase, we have people coming down with depression like never before. So one of the first things I would like to, advocate that the government should do is to see that we have a mental health act in this country. We have a national framework that can deliver, the services of mental health at all levels, whether it's at the tertiary, secondary, or the primary level, and which is going to be more importantly for me that they should concentrate on the integration of mental health at the primary health care centers. And this is going to be very, 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 interesting for you to understand that, look, if this can happen, it will just show to you that, look, the government is really showing or responding to this great demand that COVID-19 has presented. Because it will show us that with this act, in place, and the implementation and the legislation around it, it will show to you that the government will begin to prioritize the mainstreaming of mental health services even at the front line, at the front line of the responses that the COVID-19 is drawing attention to.
All right, so let's narrow it down, because obviously I know you've been working on the act, and it's because of COVID-19 that it's been stalled. The process has been stalled right now. But at this point, with regards to COVID-19, we have isolation centers, we have treatment centers. What are you suggesting?
What I would suggest, and what I know that the bill, if passed, will help, is that, look, whether it's the isolation center or the quarantine, or maybe where we have people who are already tested positive, is that, look, the introduction of mental health services or psychosocial support services would help a great deal, would really help. And this is one of the things that I want to see the federal government, from the Federal Ministry of Health and all the health agencies. I like to see them take this as a call to action. I like to see them mainstream mental health service delivery at the isolation centers. People come to be tested. Let them go through some form of psychosocial support. Let them be counseled.
So you're saying that a psychologist should be present at the isolation center?
Fantastic.
Like psychologists or
psychologists should be there. The counselors should be there. The therapists should be there. The mental health nurses should be there.
But then again, let's face reality.
You want to talk to me about the death of the mental health professionals? Well, that's not just the problem. I mean, we've talked about training, capacity building that we have a lot of nurses. If they have been trained, if there's a capacity that has been used on these people, they can provide the services.
Okay, so we have to start building capacity. In fact, starting right now, because obviously we don't have it. I mean, if it is to issue a decree, for instance, that every isolation center, every treatment center should do what you just mentioned.
So we can do it right now. We can do it by the waking of tomorrow morning. We can. How many isolation centers? How many treatment centers do we have?
I have
30.
About 30 altogether.
Yes, about 30.
So we can. So we need probably like a 5 or 6 per.
We can. We can.
Trained people.
We have trained psychiatrists. We have trained. We have how many? We have quite a lot of resident registers.
We're going to have to take this on in the next episode. But those people we're talking about are already otherwise engaged. So we're going to have to take a pause here, and we'll probably join them, or you will join us in the next episode. Dr. Ada and Mr. Zion. I mean, you can tell that Zion is totally passionate about this, right? Well, we probably need to give him a little bit, stoke him a little bit more, give some more fire here. Well, thank you so much for you guys for coming over. And
thank you.
Hopefully we'll continue next week, right?
Okay, thank you.
Okay, awesome.
Thank you.
All right, see you soon. All right, well, folks, stay tuned, and we'll see you next week. Cheers.